This is Lenny Sanacola with World at Work TV, and today I will be speaking with Tom Sondergeld from Walgreens as a follow-up conversation from last year's interview regarding their move to a private healthcare exchange. Tom, so it's been over a year since we interviewed you, and at that time we talked a lot about moving to the private healthcare exchange, the strategy and the process that you went through, and we even talked about the communication process with employees. So with a year since we last spoke, can you share with us some of the key learnings, opportunities, and challenges that you may have had in this transition?
Let's start with the key wins. I think the nice advantage of being in a private exchange is we have just returned over all the administration. I don't have to think about the strategy of the benefit design or the plan design or the co-pays or the co-insurances. My team is totally focused on the strategy and the delivery of the model. So that's a big advantage, a big win. We've also attenuated the monthly noise that otherwise would be present during a normal self-insured plan. So all that volatility is gone because we're in a fully insured exchange and we know exactly what we're going to pay every month, and our finance department just loves that. It's continuous trend in the months, so we just have trend at the year to decide about. The other big advantage is the fact that at the same time that this was happening, we were also going through an HR transformation. It was all part of the plan. I think this facilitated the ability for us to make that HR transformation smoother, because taking away some of that administrivia, pulling back on the ability to have to worry about plan design and all that really allowed us to get to that strategy, I think, quicker and a little bit easier for our team. I think the challenges we faced, and I think we will face for some time, because I think if you recall the conversation we had last year, I think that the private exchanges are here. They have a presence, but I think they're going to take some time to get established. They're new, they're neophyte years. I think they really need to kind of understand how to operate in that environment. Both the broker, the administrator, and the carriers need to understand how to operate in that environment, particularly the fully insured environment where the risk is shifted to the carrier. And I think that they're learning how to operate in this model. It's different for them. It's not the standard fully insured market that might be out there with other employers or on the exchange. But it is new, and I think they're learning how to operate in there and handle that risk so that cost increases are controlled year over year. And again, I think that's probably going to take about 5 years. So I think the biggest challenge is dealing with those cost increases that we're going to see for the next couple of years, to take back some of the opportunity, to deal with some of the risk that they're seeing, and to get a handle on the members that they're going to be serving.
Let's talk a little bit about the HR transformation that you mentioned. It sounds like there was a change perhaps in roles or redefinition. Tell us a little bit more about that.
The new leadership was put in place in 2010 with the new CHRO. She came in with a dream to redefine HR and to get HR aligned to the various components that we can be successful with in a multi-tiered strategy. We've moved into a center of expertise that kind of oversees the strategy, and that's my business. And all of the HR components operate in this manner with a center of expertise at the top, kind of managing the strategy, dealing with all the return of strategy that might need to be fixed or corrected. And then there's a tier 2 structure, and they are executing on the strategy. They run the plan every day. They take care of the eligibility problems that might exist or anything that comes up from the vendor. They manage the vendor. And then there's a tier 1 group that is more of a shared service, and they take any phone calls that might bubble over, and they handle the first line of defense on policy issues, and all that bubbles up through a management tool called Salesforce that helps us manage all that across those different strategy arms of the company. It's an interesting structure. I think it would have been much more of a struggle to get into this structure had we not had a private exchange in place. Lifting all of that burden away from the HR group, the benefits group as it is today, I think it would have distracted us from the focus that we needed to have on trying to get into this tiered approach, because I think defining what is strategy versus what is execution versus what is service, there's a lot of gray, and I think it helped define that gray better.
So clearly the strategy was in place before the decision to move to a private healthcare exchange. With the private healthcare exchange, a lot of the benefits admin had been outsourced. Could you have still kind of done that strategy not going to a private exchange? It just would have been more challenging.
Yeah, I think it still would have been more challenging. I think having the benefits administration in-house, which it was, if it would have stayed in-house, would have put so much burden on the execution and the Tier 1 folks, the service folks, that we wouldn't have been able to focus on any strategy. We would have just been focusing on how to run the plan every day, how to deal with claims appeals that we don't have to deal with anymore, dealing with the future plan design. That future plan design discussion usually took us from February until August to get done in the past. And now we don't have to talk about plan design, we talk about strategy and cost. And that's a much easier conversation to have. So I don't know that we would have been able to successfully move into the structure in such a short period of time. It would have taken a number of years to get through that process.
With the redefinition of the roles, how did that get communicated to the staff? What was the impact in terms of determining skill sets and what tier people might succeed in?
It's an interesting process. We first sat in a room as leadership and we kind of said, where would people go? Who would be the right people in each of the groups? Because we wanted to be able to execute correctly. I think strategy is one thing, but once you dream up a strategy, you have to be able to execute it, and you have to have the right people in place to execute. And that was key. We focused heavily on that Tier 2 structure to make sure that we had the right people, the right staff at the right time for the right reasons. And once we figured out that, Tier 1 was already in place. That service structure was already in place. They were the very same people who were delivering benefits in the past, and now they were just going to focus on service across all of the lines of HR. And then the strategy arm was pretty simple. Once we kind of centered out everybody else, what was left was some people who either fit well in strategy or needed to take an exit from the company.
So there was a reduction in headcount?
There was a natural reduction, either through attrition or roles that were found somewhere else in the organization for people to move to.
What's the biggest challenge with that type of a structure today?
I think the biggest challenge, we've kind of worked through this a little bit in the last 6 months. The biggest challenge was nobody knew really what their role was. You can say I own strategy and you can say I own execution, but what is that definition? And we had to be very clear and crisp about the fact that while the modalities may cross over each other at times, and as benefits have a wave, benefits has a wave. We do all this planning, we do all this strategizing, we build up to the communication of open enrollment, we have open enrollment, and then we settle back down again and we start it all over. It's very unusual. Compensation doesn't have that. They're pretty steady, they have a lot of stuff. They may have performance reviews and a little bump, but benefits has a definite wave. What we found was we needed to figure out where strategy and execution plugged into that wave and help clearly define in black and white what their roles were first. And then we dealt with the gray. And we said, there's going to be gray. So strategy may hand off something to Tier 2 to execute. They may execute it very well, but in the execution they find, guess what? A year later, 2 years later, this doesn't work so well. We need to give it back to strategy to figure out how to fix it and put it back to Tier 2 or Tier 1 to run the program again. The way we did that is we actually created an online form that allows us to share information between the three entities so that it's concise and clear about what everybody's role is as we make those handoffs across the different platforms. And that handled the gray. And so I think we really needed to define what those roles were and have regular meetings of the team, as if we had it in the past, to make sure everybody was on point and everybody understood their role and everybody was aware of future strategy that was coming. And as handoffs needed to occur, the form helped us manage through the gray.
What would you recommend to organizations that are going through this type of HR transformation, whether they're going to a private exchange or not? Yeah. Obviously there are centers of expertise are excellent in that type of a structure. What would be one or two pearls of wisdom that you would give organizations?
Yeah, I think there are two. I usually use three, but I think there are two key ones. Listen to what everybody is saying. Everybody has an opinion. Just because strategy sits up here doesn't mean that people in Tier 2 or Tier 1 or in the execution and service entities can't think of strategy. They're close to it. They understand what the strategic needs might be around this particular project. There's not like a big black line that says, no, you cannot cross over this. So listening is very key across all the entities. Strategy needs to listen to execution, and execution needs to listen to service, and service needs to listen to strategy, and vice versa. If you don't have that listening in place, it isn't a functional team. Second, I think most importantly is be very sensitive about the handoffs. there can be a lot of miscommunication about handoffs as you go from a strategic thought, which can be very dreamy, to really executing. If you're not clear exactly what you want to have happen, if you don't have regular cadence for meetings as that implementation is happening, if you don't have clear ownership of who owns the project on either side, if you don't have documented processes that help you through that implementation period for the handoff, it can be very tragic, and the project can actually fall apart because someone will misinterpret what the strategy was supposed to be, and while they're executing it, they'll trip over something and not know how to fix it. So I think it's totally being clear about what you need to have happen, if it's execution sending it back up to strategy, or if it's strategy sending something down to service or over to service. It just has to be very clear and concise.
For World of Work TV, this is Lenny Sanacola.